Just gonna give it a few minutes to get started here. Can everyone hear me okay? Can everyone hear me? So just going to be a few minutes and we'll just start talking about this very short topic on Alzheimer's disease. So, does anyone have any questions so far about any of the content that has been posted to date? Even if it's not related to any neurodegenerative disorders or any sort of um, cardiovascular mechanisms, or any, if it does not matter, but any of those types of diseases, if anybody has any questions, we can go over them, or I can post another video to talk about it in more detail. So I'll be starting promptly at 9:15. Okay. Hello, everyone. My name is Snehal Desai. Um, Today, I'll be talking about um, Alzheimer's disease, just an overview of, in a very brief overview of some of the medications that you probably see in practice, whether in retail or hospital, or any other type of pharmacy setting. Um, Alzheimer's is one of those diseases that patients would experience when they're having lots of memory loss. So whenever a um, neuron, whenever there is a neuron cell that's very dysfunctional, it's not working properly, probably because of certain, I guess you could say, junk that you would find in like a neuron cell, because um, of all the other kind of and I'm putting this in really layman terms or very easy to understand ways, like you see like a lot of trash or clogging and those kinds of things, like kind of like the pipeline is clogged and stuff like that. So similarly, whenever you look at a neuron cell, it's not like any other typical type of cell. Um, in example here, I'm going to show you, like, you might have our neuron cells are going to look more like this, and I'm going to draw it out for you all here. You have these things called dendrites. Okay, the dendrites are usually kind of like the receiving end of the neurotransmitter that flows between the neurons. And then you have this other part, which is the terminal or the ending part, um, wherever the neurotransmitter flows to go to the other part of the neuron. And you see these hairs sticking out here. And this what it is. This is the part of the axon terminal that you would see. I'm just drawing this as another review for your reference, but this is like a neuron, but then the end of axon terminal, that's where the postsynaptic complex occurs. The neuron, for example, and I'm going to come back to all that in a minute, but when you look at this, and it's very interesting, um, this is essentially that. And then and I'm going to draw a different color here so you could see here as a reference. But if we have another neuron, okay, this is the soma again. And then you have this axon terminal flowing here. And then you have the axon and then the axon terminal. Okay. But anyways, what's this part here? This part is actually the receiving end. It's typically going to be this dendritic part of it. I'll draw it here for you, here. And now you will see what is occurring here. It's very interesting to see how these two kind of can connect whenever you look at these two uh, parts of a neuron, um, or two different neurons trying to connect to each other. So, um, why am I talking about this basic concept? Because the neuron itself is very important. It's something you can't really replace very easily. It's not something that you can just grow easily. It's not something that can generate or, make on its own. This is something that's irreplaceable. And once a neuron dies, it's dead. You get the neurons get lost, and then what happens? When they get lost, you're gonna lose part of that memory. that memory could be dealt with learning abilities, language, um, and also maybe something to do with balancing and those kinds of things. Now, what kind of balances those kinds of memory activities are usually things like you would see acetylcholine, or you would see things like glutamate, or you would see some other things like GABA. Those kinds of things kind of balance out the activities that a neuron needs to perform its normal activities. However, an imbalance of all of these things can lead to diseases. One of such, which is Alzheimer's disease. And Alzheimer's disease treatments target some of these areas to prevent a recurrence of inhibition of certain activities that a patient is able to or should be able to perform on their own rather than uncontrollably um, acting over them. So, like patients who are not able to use the bathroom because it's just they're just always using the bathroom constantly, and they're not able to understand how to use the bathroom, things like that, and like those kind of cognitive abilities get impaired over time when the neurons get damaged. So in all these kinds of areas, Alzheimer's develop, um, leading to um, further other diseases as well. And so, whenever someone has Alzheimer's disease, they may also start having other problems later in the future, um, in which that will lead to early mortality if not treated in a um, proper way. So, I hope that kind of makes a little bit of sense for you all. Um, so let's take a look at some of the basic concepts here, just so you all are aware and have a little bit of awareness in understanding the treatment options that are currently available. There might be others, but as of this presentation, I've only discussed a few that you will probably see in your practice. Um, as you work as licensed pharmacists in the future, or if for those pharmacists out there who are already in practice, you may already see these medications, but the uses of these medications is important, and also in understanding the mechanisms of a lot of these meds. So I'm going to quickly go over these so you all can use as a review guide for your own studies. Does anyone have any questions so far? Now, another thing I mentioned in the previous presentation is I don't want you guys to get confused between the Parkinson's disease and Alzheimer's disease. Those are two very different things, and Alzheimer's is mostly going to lead to dementia or where memory loss occurs. Parkinson's is not really a memory loss, it's just that their inability of having proper movement is happening there. So that's more of an impaired movement type than the impaired learning and memory loss. So in this case, um, Alzheimer's disease is a progressive neurodegenerative disorder and most common cause of dementia. Um, just as I mentioned before, it is a decline in memory, thinking, language, and daily functioning. Um, and like I mentioned, some of the things that get in the way of these um, ability for these two neurotransmitters to connect, as you can see, and as I drew in the first slide, on the title slide, you can see how there is a sort of dysfunction between the two. You can see here some of the neurofibrillary tangles within the soma structure that is kind of inhibiting the functionality of the neuron by itself. So, and then some of the amyloid plaques around the neurons, that is what is preventing some of the um, functionality. It's kind of like you're adding a lot of trash in the way for the actual um, connection. Like, I can think of something else, like you're trying to, connect a piece of wire to the other side or something. But, something like a piece of uh, um, paper or something that's not going to allow it to kind of conduct is going to prevent it from doing what it needs to do. That's what this diagram is kind of showing. Just so you all can understand a little more on the neurodegenerative disorder of the neurons here. And lastly, you can see here the loss of acetylcholine. Um, Acetylcholine is important, especially for like memory functioning, learning, balance, thinking, and all of that. So with that loss of acetylcholine, with that loss, it's going to inhibit or prevent the ability for that patient to do what he or she normally does, throughout the daily life, throughout daily activities and stuff like that. So here's a clinical presentation. It's a very short chart. Um, Basically, in the early stages, you're going to see short-term memory loss. Then there is going to be, and also maybe some difficulty learning new information, word finding difficulty. Then later on, more confusion happens, and then mood changes, and then difficulty with daily activities, and then later stages where you're not in control of anything anymore. You lost your speech. You're having lots of incontinence, complete dependence, you know, and so in the severe cognitive impairment. Not to say, there is still some, and in the previous slide it says loss of acetylcholine, but that doesn't mean that there is no acetylcholine left. There's still some acetylcholine that can be used to um, uh, increase the lifespan or make the patient, live a little bit longer because of that little bit of acetylcholine ability that that patient has, um, if used with these treatments. And so um, these are usually the first line treatments is to prevent the breakdown of acetylcholine. It's through these acetylcholinesterase inhibitors known as donepezil, galantamine, or rivastigmine. And then you have the NMDA receptor antagonists like memantine. Now, um, the understanding of these medications, you can probably make it, you can break it down in your own ways. Um, but notice here, I guess you could say here you got done, you got a couple of things here, my memory, mine. These are kind of like these are the main medications you would probably use for someone with Alzheimer's. And then memory or memantine, Um, the NMDA receptor antagonist is an interesting mechanism. So that one's kind of separate on its own, but these three kind of fall in the same acetylcholinesterase inhibitors. Acetylcholinesterase is actually in various areas in the body, and they are to kind of control the overactive, probably the overstimulation of the acetylcholine. Um, so they kind of eat up some of the acetylcholine so it doesn't, um, you know, become too much. But in these cases, with someone with Alzheimer's, we don't want that. We want to make sure we preserve most of acetylcholine. So um, that's why these inhibitors are used to prevent the breakdown of the acetylcholine when going from one neuron to another. So you can see here in this diagram, acetylcholine coming from the mitochondria of the neuron, and then it is trying to interact with one of the M2, M3 muscarinic receptors that's used in terms of memory, cognitive abilities, and all. But then you have acetylcholinesterase that's also within that synapse that's trying to break down the acetylcholine itself. Um, but to prevent that, we use something called the acetylcholinesterase inhibitors, and these are things like donepezil, rivastigmine, galantamine. So that's essentially it. That's the main mechanism here for um, treating someone that have Alzheimer's. Now, there's no cure to this, but it will at least help the patient um, or assist them in their cognitive functioning rather than, um, seeing a rapid decline in their activities. So that is why it's important to make sure that its patients are treated early in the process when they experience this kind of Alzheimer's disease. So at least they're not losing too much um, of the memory. And so that's why I just wanted to show you this for your own reference. And I hope this kind of helps you out, kind of a little bit understand, these diagrams. Um, the next one here I want to show you is the NMDA receptor antagonist. I was looking at this just for a little while, just because it was very interesting to me to see how um, glutamate is actually, an excitatory neurotransmitter. And this kind of connects to another type of disease state. It kind of mixes up a little bit with like someone having seizures, for example. I mean, it's almost very similar. But here, um, memantine is just to make sure that there isn't too much, is to make sure that there isn't that much calcium being released into the neuron. So that, it just is not overstimulating or damaging some of the enzymes and some of the functioning of the neuron. So the purpose, calcium, and I'm pretty sure you saw in this other previous presentations, or if you have not, I would highly recommend you go through them again. Um, but I think the um, calcium, you've seen some of it where it's kind of more like a contraction or contracting phase, and like the heart as well as release of the neurotransmitter from the vesicles, and you kind of saw a little bit of that. Um, but when there's too much of this, when there's too much action with it, when there's too much glutamate, it's going to become a problem. So similarly with someone with seizures, you're going to have too much glutamate, too much problem. But memantine is mainly used for the Alzheimer's disease. It is specifically designed to block the glutamate from binding to the NMDA receptor because it binds to the NMDA receptor before glutamate reaches there. And so it prevents that release of the calcium. But again, there might be some confusion there, but just note that this is the memantine we're talking about. That's for the Alzheimer's. Um, and and give me 1 second. Um, it's a very interesting, preventing the excited toxicity, but memantine is by itself mainly used to treat someone who has an Alzheimer's disease, is to control the flow of the calcium altogether. So, anyways, that's pretty much it in this presentation. Does anyone have any questions so far on any of the content, any of the reviews, any of this? I think we kind of went over a lot of things here. So um, if anyone wants to go over anything or review anything, please feel free to reach out to us. You can leave a comment or a question or anything you like on our FarmBits YouTube channel page, or you can you can connect with us on our Facebook Farm Insurance page as well. If uh, anyone wants to do a further review on any topic and wants some tutoring help, again, we are doing that. The only thing is with the tutoring, we haven't really fully initiated this process thoroughly yet. We are working on it still, so um, feel free to reach out to us. It's going to take a little bit of time for us to get you all the materials, um, as we are working as best as we can, um, because your success is actually most important to us. We want to make sure that we give you all the content you need to make sure you successfully pass the exam. And that's pretty much it. And so if anyone has any questions or anything, feel free to reach out to us. And thank you for watching. I hope you all have a good day. Um, we will be talking about some other topics as well. And there will be some shorts that will be posted to keep you updated with the latest material as you move forward with your uh, or throughout your career. So thank you very much, all, and have a good day.